Good morning, friends. I'm Dr. Aajay Shah, bringing you another great weekend live. And today I have a special guest. Our guest is actually expert into lifestyle medicine. She has her own telehealth program over many states. She's a great friend. She actually is a person who walks the talk. So listen about her own story. And if you want to really reverse any of the chronic disease, including diabetes, high blood pressure, and many of the chronic disease, this is a must watch to live. So please stay tuned in and let's welcome Dr. Miller. Welcome, Dr. Miller.
Thank you so much. It's so great to be here with you today.
Oh, thank you. So let's start with a simple question, which I ask every guest is that where do you live and what type of physician are you?
I currently live in New Hampshire. I just moved here after being in Colorado for many years, and it's beautiful out here, especially right now in fall. I am originally trained in emergency medicine, so I worked in the ER for 10 years, but I switched over about 10 years ago now, and I have been doing lifestyle medicine ever since.
Wow, that's a great thing you did. Lifestyle medicine, we need more and more brilliant people because I think lifestyle medicine field is growing. When I took my lifestyle medicine boards 2 years ago, there were only a few cardiologists, and now I see many more cardiologists are getting interested into lifestyle medicine. So making a switch from ER physician to lifestyle medicine is a great switch. So I also want to hear your own health journey. And actually, what motivated you to get into healthy lifestyle for yourself and eventually into healthy lifestyle medicine?
So I was working in the ER and I loved my job in the ER. And I was working full time and running for office and helping to run the department. And I started getting my own joint pains and I was diagnosed with lupus. And I started taking the medications and I didn't want to give up my job in the ER because I loved it so much. But I started not feeling well. And all those shifts, I did not feel well. And I kept getting put on more and more medicine. And I didn't know anything about lifestyle medicine. This is 10 years ago. I had no idea diet played a role or my lifestyle or my stress or my sleep. And so I continued to push through it, but I was not doing well on 6 medications. And I was really scared. And for the first time in my life, I was depressed. And I'm not a depressed person. And I started crying every day and it was terrible. And I related with all my patients in the ER. They would be sad and I would be sad and it was a disaster. And so on my own, I just started looking, what can I do to feel better? And I learned for the first time about the power of nutrition, about what I was eating. And I was like mind blown. And I flew out and I got to know Dr. Furman and learned from him. And I got to know Dr. Esselstyn and I learned from him. And I started going to conference and I went to every lifestyle medicine. I went to functional medicine. I studied integrated medicine because for me, it was more than just the food. It was my whole mind, body, my stress. It was so much. I had to like start all over and get a holistic approach. So I did all of that. And then all I want to do is share it with my patients. So they'd come in the ER and I would just want to talk to them about their diets and how they were living. And so I just had to switch over then and open my own practice.
Wow, that's a great, yeah. And when we talk about the 6 pillars of healthy lifestyle, like you just said, nutrition is the most important pillar. So please tell us where we stand with the standard American diet. And then please tell us what should be a healthy diet for all of us, including whole food, plant-based, no oil diet.
So yeah, there's so much data now and there has been for years and it's with all this confusion now and people don't know what to eat. But when we really dive into the data, it's there for us, which is why I'm so disappointed. I never knew about it years ago. And it's my mission to teach people that the data really is there. When we eat fiber, when we eat real whole foods as nature intended it, and we get plenty of raw with all those living enzymes and nutrients in raw, and we cook some of them and we learn to eat this fiber and diversity of fiber, we're learning more about that as well, that people thrive, people really do well. And so from the standard American diet, which is processed, which is high in fat, which is high in animal products, and all those chemicals and additives are destroying our guts and leading to autoimmune diseases and inflammation and diabetes and metabolic dysfunction and all of these problems that we're seeing. And we love these foods and we're addicted to them, unfortunately. I was too. I was right there with everybody else eating my Twizzlers in the middle of the night in the ER. And so when we learn to love the fiber and how good we can feel, it changes everything. So the standard American diet, it's time to start to work our way for everybody, and whatever people's goals are. Some of us go fully plant-based, whole foods, and some people just mostly or a little, but everyone, if we can move in that direction, we'll all see health benefits. So it's really important.
Yeah, I think I agree with you. I think standard American diet, as I understand, 65% processed food, 25% animal products, and the remaining 10% where it's plant-based is mostly processed plant-based food and a lot of the French fries and ketchup. And so whole food plant-based, which we try to follow, is probably less than 2%. And again, obviously the outcomes are obvious to all of us. You know, obesity is 42% in America, and it's predicted to be 50% in next 5 to 10 years. So I think we definitely know that what we are eating is not working. So we need to make change. And that's why you said in a very right way that we are not asking everyone to go vegan. We are asking people to eat whole food plant-based. And then if they have small amount of animal products, if they have small amount of processed food for a convenience, I can understand. But out of 21 meals, if someone is eating all 21 meals processed food and animal products, that's just not healthy. I think when we look at those blue zones, you know, blue zones, typically people are not vegans. I mean, they have 10% calories from animal products, but their main principle is that they are whole food. I mean, they eat what is nature makes. And I think that's the reason they live long, they live healthy. The healthcare cost is very low. And in general, they're a very happy community. They're active at 80s and 90s and 100s. So I think I agree with you. I think that brings my next important kind of burning question, which has been very popular, and that's about the fiber. You talked about the importance of fiber, importance of diversity, even in terms of what kind of plants we should eat. So please explain the role of fiber in our diet.
It's a great question, and this is a good time because fiber is making a resurgence, right? Dr. Will Bulsiewicz's book, and he talks about the power of fiber, and so there's so much about it. But I started getting really interested in it probably about 5 or 6 years ago, 2014-ish, when I read an article that autoimmune disease was linked to fiber, and when people ate higher fiber intake, that they had improvement in autoimmune disease. So that interested me, and I started reading everything I could about it, and like, how could that be? And why is that? And I was interested in, should it be a raw diet? Should it be a cooked diet? But they were just talking about the fiber, right? Fiber in general, because it feeds that microbiome, the bacteria that live in our colon, so far the way down, they need fiber and resistant starch. And if we're not eating fiber, if we're eating white bread and bagels and burgers and French fries, we're not getting any fiber in there. So it's digested and the nutrients are absorbed before it even gets to the colon. So our microbiome is starving, and they start eating our mucus layer and degrading our intestine wall. And then we start having inflammation, and we wonder, why do we not feel well? Or we're gaining weight for the first time in our lives and we can't lose it, or our blood sugars are out of balance, right? And we can't understand that. And so fiber feeds them, and then they put out nutrients and small chain fatty acids and different chemicals that repair our guts, and the inflammation just calms right down. And it's almost magical, but it's science, so it's not magic, but it's amazing. And so more and more and more, there's so many articles about this now for all different types of diseases, from heart disease, hypertension, to Alzheimer's and neurodegenerative, to autoimmune. I mean, it's amazing, the power of fiber and different fibers. And we want to just not eat the same. We don't want to eat kale every day of our lives, but eat all the different green lettuces out there. See what's in season, see what you can grow in your backyard or your garden or in your house even. Try all the different ones, diversify. And yeah, that's where health lies. I really believe that.
No, I think you covered so nicely about the fiber. I mean, fiber is probably the only nutrient which has shown that if you increase the fiber intake by 10 grams, the mortality goes down by 10%. And as American, we eat average about 12 to 15 grams of fiber, and the recommendation is anywhere 25 to 35 grams. And I think, in my opinion, the optimal fiber actually is about 50 grams. I think in those blue zones, they get about 70 to 80 grams. So I think we definitely are eating less fiber than what is recommended. Definitely, Americans have actually become more of a protein-centric instead of fiber-centric. I think if you want to live long, we should be eating less protein than what we are eating in America, and we should be eating more fiber. So that brings my next question. And that's always a burning question as a vegan, that where do you get your protein? So my question to you is, number one, how much protein we need? Number two, are we eating more protein than what is healthy? And number three, what kind of protein source we should have, plant-based or animal-based?
Great questions. And people always wonder because on a standard American diet, protein comes from animal products. Because if you eat white bread or you eat mac and cheese, right, there's no protein in it unless you're eating the animal products. But on a plant-based, whole food plant-based diet, it's completely different. So now we are eating vegetables and legumes and whole grains and nuts and seeds. That's our standard diet, not the processed food. And they all contain amino acids. So all of these foods have amino acids in it. And so just by eating a diverse diet, and I always tell my patients, like if I eat 2 cups of broccoli, let's say, or I cook it down, I steam it, it's 1 cup of broccoli. That's 2 servings right there. Broccoli, well, broccoli is 50% protein. You know, there's only 3 things that give calories: protein, carbohydrates, and fats, and that's it. And broccoli is not mostly carbohydrate, and it's not mostly fat. It's got a little of each of those, and it's got protein in it. And they're made up of amino acids. So I think of it in terms of amino acids. So if I do, you know, I'm doing greens and oatmeal, and I'm eating legumes and more greens, and I'm eating more, you know, maybe a little tofu and more greens and some whole grains, I'm getting plenty of protein. So I'm not worried about that. But a second thing that's so interesting is that we don't need as much as we think we need. And so people are trying to get too much protein. And so we don't want all that high protein. We know now that protein stimulates pathways that age us faster. And so there's actually becoming more and more evidence that when people eat less of the animal protein, we don't stimulate those pathways and we don't age as fast. We don't get as many chronic diseases. So we know this, and we're seeing it in the longevity studies, as you talk about with the blue zones, as well as so many other studies now. And so 2 is that we don't want extra protein. But 3, I do talk about protein with my patients still, because as people age, some of them aren't thriving. And I live in places where I work with a lot of athletes. I lived in Aspen, Colorado for many years, and now I'm in New Hampshire. And I work with a lot of athletes who do need a little extra protein, plant-based protein. And so we make sure that they're getting hemp seeds and legumes, and that they are covering enough protein too. And as people age, we want to make sure that they're getting enough protein not to get breakdown of their tissues. So it's interesting. We don't want too much, but we also want to make sure people are indeed thinking about it and getting a well-balanced meal.
Yeah, I think you covered it so well again. And I think protein, you know, fortunately, when we eat 2000 calorie diet for a person of size of me, I know I get adequate protein because, you know, nature is great. Nature actually puts average. If you have an average, you know, variety of plant-based plate, then your average protein is about 10 to 15% of the calories. So if I eat 2000 calories, that's about 200 to 250, 300 calories from protein, and that's about 50 to 70 grams. So I think I get my perfectly recommended right amount of protein if I just eat variety of food for the calories I need. I think protein deficiency is seen only in the people who are eating extremely low calorie diet. If you get adequate calorie from variety of whole food, plant-based food, I can assure you, I can guarantee you, or all of our viewers, obviously, to that we get enough protein. And number one. Number two, like you clearly pointed out that there are certain pathways which are proven now, like mTOR pathway. I think when we eat lots of protein, you know, it stimulates that pathway. And I think going away from the stimulating that pathway is the way to go. And I think, and also you also pointed out that there has to be a happy balance. I think protein gives us that, you know, benefits in terms of balance, in terms of you know, bone health, in terms of the, you know, insulin sensitivity. So we definitely need muscle, we need protein, but it's the happy balance, you know, where that comes. And I think that's where Americans are missing. I mean, all, like when we get a trainer at our house, first thing he asked me, did you get enough protein today? I mean, you know, the protein has been so much oversold because of the marketing and the commercialization, because like you said, most protein in America means animal products. And I think animal products are so much over marketed in this country, so that every industry has an invested interest in making protein as the most important nutrient, while actually it's the fiber, like we talked about it, and actually it's the whole complex carb, which are more important nutrients. So, you know, I think protein, we can keep talking about it. I personally feel that plant-based protein, if people want to have a little extra protein, like you said, elderly patients or elderly people or athletes, I think plant-based protein is much more forgiving, because if you get 20 grams of extra plant-based protein, it has been shown that it's much more forgiving in terms of the mTOR pathways and other things. So definitely, if you have extra protein because you think you need it because you're an athlete, consider plant-based instead of animal-based. So that brings me to the next question, and that's been always very controversial, even within the giants and the whole food plant-based vegan advocates, and that's about the role of nuts. Obviously, nuts are great healthy fat. At the same time, it packs a lot of calories per pound. So what are your views on nuts?
I love them personally. But so yeah, if you look at the data, there is data that people who eat nuts and seeds, and some of them are from the Seventh-day Adventist studies and from the Blue Zones, but people who eat a small amount of nuts and seeds actually did better. A couple things that they do, things like stabilize some of the dysrhythmias with hearts, things like walnuts have been shown to do that. We know that it helps with cardiovascular disease. A small amount of nuts can help pull out cholesterol and has function there. We know that the omega-3s from flax and chia seeds are essential. We know that it helps with healthy aging. Some of the DHA and the EPA that we get, that we can make, synthesize from eating nuts. And so there are minerals, there are nutrients that are essential from nuts that really add to a diet, and the studies show that they promote longevity. So I do promote nuts. That being said, there's also good data from people like Dr. Esselstyn, who put people on a very low-fat diet to reverse cardiovascular disease. And so, in teasing out some of that data, I really believe that for certain people who have certain genetic makeups, some of the ApoE4 pathways, that they can't process fat as much. So certain people will need to be on a lower fat diet, even on a whole food plant-based diet, in order to get their cholesterols down and to reduce their risk factors. And we can monitor that. I do advanced labs on a lot of my patients looking for things like this, because especially if their cholesterols aren't coming down and they're not getting the results that they want on a whole food plant-based diet, then we have to cut back on their nuts. And then it's usually about an ounce or a quarter cup. And I don't say no nuts. I always want people doing a little bit of flax or chia seeds. There's just too many benefits from it, and it's very anti-inflammatory and prevents disease. Maybe even a few walnuts or a few nuts here and there, but a lot lower fat diet in certain people. And the other thing is, we know that there are omega-6 fatty acids in nuts and seeds, as well as the omega-3 fatty acids. And the omega-6 are pro-inflammatory, and the omega-3s are anti-inflammatory. And so when people eat a certain amount of nuts and seeds, and it's usually about half a cup, truthfully,
ultra low fat diet could be beneficial. So I think in general, nuts, 1 ounce is perfect. More than that is not necessary, like you said, about pro-inflammatory state. And I think it also is a very calorie dense food, so we should not be eating too much nuts. Like I've seen some people that they think the nuts are good, and they pick up the bag of cashews at a gas station, and while they're driving half an hour, they finish the whole bag, which is 800 calories. So that could be more than our lunch or dinner. So I think be careful with how much nuts we should have. But at the same time, I agree with you completely in my patients too. 1 ounce of nuts, preferably walnuts, is probably the best thing to do. So that brings my next question, which has also been very controversial. Recently, there was a report that women who drink milk have a higher chance of developing breast cancer. So again, I think dairy is always very controversial. In my opinion, probably dairy is not necessary for a healthy lifestyle. What are your views on dairy?
I agree with you completely. So the data is showing that dairy is not healthy at all. And I am with you. Basically, one of the first changes I try to help my patients with is getting people off dairy. Digestion improves so significantly, and gut health starts to improve, and inflammation and joint pains start to improve. One of the big things that's so dramatic is asthma improves, and nasal drainage. People who wake up with sinus congestion, nasal drainage improves, and the data is just showing so much harm with dairy products, from type 1 diabetes in kids, that there's a link, from autoimmune diseases, which that hit me near and dear, because I used to drink a lot of milk thinking I was being a good little girl, and then I get my own autoimmune disease, and I was like, what? There's a link here. So it definitely affects our gut microbiome and inflammation. It directly causes inflammation in our guts. It's linked with, it even doesn't reduce bone fractures. When they do multi-country studies, they see that women who drink the most milk actually have the most bone fractures, and because we can't even absorb most of the calcium from there, and it's so difficult to metabolize it and keep our blood pH neutral with milk. So I'm not a fan of it. Plus everything else in the milk, all the chemicals and additives from drinking it from the breast of the mama cow, like it's not a good thing. So I work really hard with my patients to get them off milk. Now, some people will choose to eat a little animal products, and I can work with that. We can all develop a plan, but we should not be eating dairy products every day and thinking that we're eating healthy. So, and I tell some of my patients, like I do have some patients who, if you're gonna have a piece of cheese, get the good fermented real cheese and you eat it the way you'd have a fine glass of wine. You eat a small amount and you savor that bite. You don't think of it as a health food. It's not a health food. And so it doesn't mean, for a healthy person, it's not like they could never have this, but don't think it's healthy. Don't eat it 3 times a day. And for people reversing chronic illness like myself and many of my patients, then I don't recommend it at all.
Yeah, I think I agree with you. So if a family or if a person wants to start whole food, plant-based, no oil lifestyle, and they are right now eating all typical standard American diet, what kind of steps or what kind of things they can do to eventually become whole food, plant-based?
That's a great question. So what I've learned from working with people for so many years now is people are different. So some people like myself, I jumped right into it. I had a chronic illness. I was scared and this seemed like the answer and I jumped right into it. And that worked for me. We just kind of overhauled it, but that doesn't work for a lot of people. So when I work with my patients, we kind of start talking about it. If they're with a very serious chronic illness, then we kind of got to go for it a little more aggressively, like make the changes. Let's get the inflammation down, get you feeling better. So I do a couple things with people. I have them start by adding in more raw vegetables. I feel like everybody needs to eat a little more raw vegetables. So maybe small salads, maybe they can pick an apple, more, fresh fruit. So with each meal, we start adding in, just simple adding in. Some people can do green smoothies. They're not fruit smoothies. They're made to be greens, so that you're getting your leafy greens and you 75% greens and 25% fruit. So we can do a green smoothie if they want. But even just that, people will start to feel better, start changing our taste buds, and we start crowding out the other foods. So instead of having a piece of pizza and a brownie for lunch, first you got to eat your salad. Now, if you still want a little bit of pizza, fine. You can have all of that, but first we got to get the nutrients in us. So I start often by just adding in. I give people a list of colors of the rainbow, all different kinds of fruits and vegetables for different colors. They can start choosing. They can realize the different opportunities that are available to them, that there's actually opening up a whole world of new foods that maybe they haven't been eating very much, and different ways to prepare it. We can start simple, where you buy it and you just quickly make soups, or you quickly make salads, or easy peasy, or you can do a little more complicated and play with some different recipes. Totally depends on what works for that person and their family. And so just by adding in and crowding out, and then from there we'll start to push out things like dairy products. We'll encourage people to less and less in that. And then I say go with one meal at a time. So maybe breakfast, can you add in, maybe you can do a oatmeal with colorful berries and some nuts and a little bit of flax or chia seeds, so you can get breakfast. Great. And now what about lunch? Can you you're crowding out everything else, and then when you're ready, you can think of some good lunch ideas, and then maybe you're ready for dinner. So you can kind of go gradually. We celebrate every step. When my patients do one new meal, we're celebrating, we're getting excited together so that they get excited. The momentum keeps it going, and we have support. We all went through this, so we know there's hardships with it, and there's good days and bad days, but they become more and more good days, and we celebrate and we cheer each other on. And yeah, it's a fun process, but it's a process.
I think your tips are very practical, and I agree with you. I think we all are different. I jumped in also almost overnight like you did, and I reaped the benefits very quickly. So I think if you do it quickly and overnight and very, very fast, benefits will be faster too. But at the same time, we all have different commitments, different priorities, different family situations, and we go at our own pace. I think as long as we are on that journey, benefits will be keep coming. And I agree with you that maybe start with a meatless Monday, or start with a whole food plant-based breakfast. That means every breakfast for 7 days, you will do whole food plant-based. So whatever fits you. And I think I agree with you. I think replacing some of the unhealthy ingredients and putting healthy ingredients, particularly plant-based, is probably the way to go, because nobody's going to have energy and time to pick up a new recipe book and then make a brand new dish. Whatever they're eating every day, they are the one they're going to keep eating the same recipes and same dishes every day because we've been used to with it. So I think taking the same recipe, just replacing the unhealthy part. And like you said, instead of having a chicken, we can add a tofu. I mean, there are ways, or instead of having a paneer, like the dairy-based thing, we can just add tofu. So I think we can just replace the unhealthy ingredient and make the same dish, same recipe, except now it's much more healthier. And eventually the whole dish, and you don't have to even do the whole amount. You can mix small animal product and small plant-based, and then eventually it'll be all plant, whole food plant-based. I agree. I think people go with a different pace and different method. So that brings the next pillar of healthy lifestyle, and that's as important pillar is the physical activity. So please tell us that what is the role of staying physically active, moving every hour? And if a person right now is, I hate to call them, but they are couch potatoes, how can they start safely a good physical activity?
I'm so glad you asked that question. It is so, so, so important. And sometimes we get caught up in just talking about the food and we forget to talk about we were designed to move. Our bodies are designed to move. And I want everyone to remember that no matter what, even on our worst days, when we're not feeling well, when our joints are stiff and we have no energy, and trust me, I've had a lot of those days myself where I was just laying around because I felt terrible. I had to move my body. Our joints, they lubricate when we move them. So the more we move, the more we stretch. When we walk, we circulate the blood through our body. We can get rid of waste products. Our hearts start to pump. It does what it's designed to do. We have to move. So we have now become into a society where we don't have to move as much, and we've made it easy and convenient for ourselves. But that is not the right answer. So I encourage 100% of my patients to commit to moving for me every day. And we don't have to call it exercise. Just remember that you are designed to move, and you have one precious, beautiful body that you have for your whole life. And if you don't use it, it's going to rust. It's going to age faster. It's not going to be fluid anymore. It doesn't work. And there's really good data for people with joint pains, arthritis, including autoimmune arthritis, like rheumatoid arthritis and lupus and others, that when they did yoga just 3 days a week, that they had 100% had significant improvement by what they reported in their joint pains afterwards. And I read that data about 4 years ago, and that's what, I was having a lot of joint pains myself, even on a whole food plant-based diet. And so I thought, okay, this is good data. I'm going to go to yoga. And I started going to yoga. And after after a couple of weeks, my pains completely went away, and I commit to 3 days a week. And now I do it at home. I do it on a YouTube video, and I just do 30 minutes. But that just is an example of lubricating our joints and moving it. And you can start with SAFE, you can start the SAFE program. They have all sorts of ones for healing, for people who can't move, who, for whatever age you are, whatever your limitations, there's chair yoga, things like that. So that's one example. And then the second thing that we have to do is we have to do cardiovascular activity. We have to get moving. So I urge my patients, if people aren't used to moving right now, that can they just walk to the end of their driveway and back? Can they walk to the end of the street and back? And maybe they can't with COVID-19. Maybe they're kind of hunkering down right now. Then can they walk around in their house? Can they walk in place, play a song, and be that kid that you once were, and dance and move your body and just start loosening it up and appreciating this great body that we have. We have to move. The goal is eventually going to be 10 minutes at least 3 times a day. So 30 minutes is what we're going for, but we can just do 10-minute breaks if people need. That's kind of the minimum, but start with whatever. If my patients moved for 5 minutes, if they walked, I'm celebrating with them. That's a start. Every day, commit to it. If it's just 5 minutes, it's great. It's 5 minutes. We're committing to it, and soon it's going to become more. So that's essential. And then the next thing is, I always have my patients work on different aspects of exercise. So after they kind of get that, as they're starting to feel a little better, a little bit of resistance training. We've got to build muscle to build bone. And if we don't use it, we lose it. It's 100% true with our bodies. So just a little muscle building, then we will build SAFE programs. And many of my patients seeing trainers or physical therapists, or I work with them to give them a few safe activities that they could do. And then I help my patients to work on flexibility and balance, because as we age, we lose that too. And it's pretty amazing. So I actually felt like my balance was off, and the yoga has helped me kind of get my balance back. And so I help people work on just simple little activities that take 5-10 minutes a day. and can help with balance as well. So when we help our bodies, and this is a gradual program, someone who's not doing anything will start slow and make sure that they're safe, make sure that they can exercise, that they're not in an inflammatory state. When people exercise in an inflammatory state, it can cause problems. So we really want to be gentle then. But yeah, I'm a fan. Got to do it.
I think you covered it so well again. I think start slow, build it up. If you don't use it, you're going to lose it. And at the same time, I think have a small segments, have a 10 minutes 3 times a day. And I think anybody can spare 10 minutes in the morning and 10 minutes in the afternoon, 10 minutes in the evening. I think if you are busy working 40, 50 hours a week, then just do it in the evening. But 30 minutes a day is required to stay healthy. And that's a commitment we have to make it to ourselves, 30 minutes a day. And like you said, we have to have not just the cardio, but also light strength training, whatever your body can allow, and also the training for flexibility and balance. Because as we get older, particularly after 70, fall is a major issue. And when a person falls and breaks the hip, that can actually, just get into, pulmonary embolism, which is a blood clot in the heart. A lot of people after hip fracture, unfortunately, die within 3 to 6 months. So I think fall prevention is very important. And that's where I tell all my older patients that having a balanced training, having a flexibility, all those things will, even if you fall, the fall will be much more tolerable than breaking the hip. So I think I agree with you. That brings my next question about the next pillar, and that's the role of the sleep. Obviously, we all have gone through as physicians many times when we are on call as an intern, the next day is absolutely ruined. So I know the importance of sleep, but a lot of people still think sleep is like a waste of time. People who want to be successful, they should not be sleeping. They just should be working 24/7, which is so exactly opposite of what sleep does to us. So please explain the role of the sleep.
I'm with you. When I was in medical school, we used to say, I'll sleep when I'm dead, because we had so much to do and we had a lot of studying and work to do. And then we wanted to be social too and have fun. And so we just didn't sleep. And now the answer to that is I'll be dead faster if I don't sleep. So sleep is crucial to a healthy lifestyle, healthy aging, and to disease reversals for all of those. So I actually overhauled my whole life. I don't work night shifts anymore. And that's by design, because I need to sleep at night. So when we're sleeping, several things are happening. We're cleaning out. We're doing that. This is when the housekeeping happens. Cleaning out our brain, right? We clean out those plaques that are going to eventually lead to things like Alzheimer's and other dementias. So we're doing the housekeeping at night. We're also repairing DNA. We're repairing our guts. That gut lining is just one cell layer thick. So when we're sleeping and we have melatonin circulating through our body, it's actually going to our guts and repairing those cells and lining them back up and restoring them to health. So the next day we're at optimal health. So that all happens when we're sleeping. So if we don't sleep, we don't get that repair time. It also helps us to form memories. The first half of the night we're forming memories, and the second half we're consolidating them. And so it's so interesting. Like when I was young, I used to stay up late, pull an all-nighter studying for an exam. And now that was the exact opposite I should have been doing. I wasn't solidifying the memories. So gosh, the way I study now and I have to learn as an adult is totally different. The night before anything, I'm getting a good night of sleep so that I can sleep carefully. And I work very hard with my patients to work on sleep hygiene, because so many of us, and myself included in this, we're not good sleepers. And so learning that getting outdoors, again, back to that exercise thing, if we can get outdoors and in bright sunlight and move our bodies, we will all sleep better. That's essential to sleeping well. And if we don't eat too close to going to bed, so that's real important. I used to eat till right before I went to bed. No wonder I couldn't sleep, but it takes a lot of energy to digest our food. So we really want to stop eating a couple hours before we go to bed, so that when we go to bed, we're already digested, and now our bodies can repair and relax and do all the good things that need to happen when we sleep. So I have a whole routine of things I work on with my patients, and those are just two of the real important ones that I share to help people improve their sleep, because it's so important. You're exactly right.
Yeah, I think I agree. I think sleep is probably as important as other pillars. And I think I remember distinctly whenever I had a busy night on call being a cardiologist, next day I had a very, very increased appetite. I also reached out for some of the unhealthy food. I wasn't as productive, which is probably understandable. And I think even though I wasn't as sharp as when I had a full night's sleep. So I think sleep actually is must, like you explained in a very nice way, that is must for our progress, must for our success, not just for health, but it just has to be a successful individual. And I think I've seen many times I was a lot more grumpier with our kids and with my spouse when I did not sleep. So I think it just makes you a nicer person too when you sleep well. So I think sleep is very important. So that brings the next important pillar, and that's about the stress management. You know, with COVID-19, with day-to-day what we go through in America, even in the whole world now, stress has become a major issue in terms of chronic disease, dying prematurely, depression, anxiety. So how do we manage stress? How do you manage stress for yourself, being a busy physician now with the telehealth and everything else? And how do you advise your patients and your friends to manage stress?
I'm so glad you asked this question because I think that life is all about being in a happy state of mind. It's not just the food. And so when I work with my patients and they come and see me and we're going to do dietary changes. So on the first visit for every single one of my patients, we work on dietary changes. I'm jumping right in to help them, and I'm working on stress management right away. Those are my first two topics. And I'll even often cover the stress first because people sometimes don't want to hear about that. They want to hear about the food. What should I be eating? And I need to tell them, I need them to know that their stress, their anxiety, their worries, these thoughts we have in the frontal part of our brain, and we ruminate them, right? We think about them over and over and over again, how terrible it all is, goes to the back of our brain and releases over 100 stress hormones to our whole body, and our vagus nerves, to our heart, to our lungs, to our guts, to everywhere, to our bodies gets turned off because we're in sympathetic, we're in fight or flight, we're thinking these terrible thoughts, and it is affecting all of us. It ages us faster, it shortens our telomeres, which are the ends of the genes, and that's been shown to age us faster. And this is just related to our stress and our thoughts. And I am a very anxious person myself, and when I first got lupus, oh my gosh, all I did was worry and worry and worry and worry and worry. I made it 1,000 times worse than it should have been, right? So I work very hard. I trained in integrative medicine on purpose to learn the whole mind-body connection. And I have a whole trick, I call my Jedi mind tricks, to help people work on their stress, because people won't reverse disease without that. And so a couple of my favorites are just simple deep breathing. When you slow down your breath, and we forget to do that. And I can hear that when I'm listening to my patients, you probably can too, that they don't even take deep breaths anymore. They're shallow breathing, right? So I want them to slow down and just breathe in nice and slow and breathe out nice and slow. What happens is you trigger your vagus nerve by stretching your diaphragm. That vagus nerve puts you into repair mode, to rest and restore mode, and out of sympathetic flight, go, 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 go. And it turns everything down. And it's essential to aging well, to being healthy, and to finding happiness and joy and contentment in this world. And so the deep breath, I have all my patients doing rounds of that, just 1 minute, twice a day. And I love yoga personally. I know it's not for everyone, but for me, in my busy life, I've committed 30 minutes, 3 days a week. So I don't feel like it's that big of a commitment, but it really helps me personally. I love mindfulness, going outside and just being in the moment, just looking at the sky. If it's raining, if it's sunny, if it's windy, whatever it might be, just being there and just being in the moment, feeling, appreciating, being curious about it, and resetting ourselves. And it resets all of our hormones. And I love gratitude. And even on the worst days when I don't feel well, or something bad is happening in my family, or I'm scared or anxious, which there's a lot of that right now. I'm feeling it too, and my patients are feeling it. And it's so important that every night I journal now about 5 things I'm grateful for that day and why I'm grateful for them. So it just takes me like 5-10 minutes, but it resets me. So before I go to bed, instead of being filled with worry and anxiety and fear and all these negative thoughts that my brain is so dang good at coming up with, I am now resetting myself into gratitude and all the good things that happen. I look at all the good things that happen. There were good things too, even though I'm ruminating on the bad ones, right? And it resets me, and I'm trying to redevelop my brain towards a happier, calmer sense. And then there's meditation, and there's so many different techniques. So whatever works for people, find what works for you is my advice, and commit to it every day. That's it, even just a few minutes. It's essential.
Wow, you covered it so nicely. Plus, you also emphasized that stress management probably is the pillar. Many times we have to start with our patients and with our clients because until we get their stress down, they're not going to be better eaters or exercisers. First thing is to work on their mind. I think mind is the one where all thoughts are created, including thoughts about healthy eating. So I think if we don't take care of the mind to right off the bat, then I think we're not going to go anywhere. So I like your approach of looking at the stress management as important as nutrition, even possibly more important. And I agree with you. I think observing breath, that's a technique I learned from a friend, and I do it in between patients. Like you said, just 1 minute. I think sometimes we don't have time for 20, 30 minutes of meditation, but observing breath is really readily available. It doesn't cost anything. You don't have to even close the eyes. Just sit on your chair and just observe the breath going through your nostril in as slow. And like you said, make your breathing breaths deeper and deeper and just slow it down. And I think also, I think in terms of mindfulness, gratitude journal, I have made a list of actually all the things which has gone good in my life, including coming to America, including living in the best democracy in the world, including living in the Midwest, which I love living in Midwest, including living in a nice house, having a nice car, nice spouse, nice kids. So I have made a master list. And that list almost has like 25 or 30 items. My parents, they're still alive. My brother, my sister, my friends, you. I mean, I have a long list. And I have that list in our kitchen right in front of me.
Love that.
Whenever I have a busy day at work, whenever I feel like they did not go right for me, I look at that list, and in less than 3 minutes, reading that list makes me feel I'm so much thankful that so many great things have gone well in my life. And we all have a bad day, we all have bad week, but when we look in the totality, we all are very fortunate the way we are going through. Obviously, with COVID-19, many patients, many people have lost their job, they have lost their loved ones, but in totality, we all have generally good thing going for us if we find that. And having a list in front of us, because when we are stressed out, when we are feeling down, our mind tricks us and doesn't make us think what is good. But when there is a physical list, our eyes will never trick us. Our eyes will read what is in front of us. So having in front of me in the evening, it just automatically is just my go-to place when I don't feel good. My go-to place is go to my master gratitude list. So I agree with you.
Awesome. That is awesome tip. And I'm going to start doing that too and hanging on my fridge. I love that.
Thank you. So let's go to the next pillar, and that's about the role of relationship. We all obviously animals, humans, we all are social people, social animals. So I think I always feel like if somebody wants to start on healthy lifestyle, support from the spouse, support from the family, support from the partner, support from the friends, support from the community, support even from the whole world is very important. And that's where this important pillar of relationship comes in. So what are your views on relationship?
Isn't it cool that they made that a pillar? I love that, right? That it's that important because like growing up, like I love my friends and I'm a very social person and I have to connect. One of my favorite things to working in the ER is that we're a whole department of people. We all work together. We're all in it together in the busiest, craziest days. It's our patients and our staff and our nurses and our techs and me and the doctors. And it's just wonderful to be with other people. And that is a pillar now, right? Used to feel kind of guilty time with friends or socializing, like, oh, I don't have time for that. I got to work or I got to be with my family. But now we realize that no, actually connecting is essential. It's a pillar. And in the blue zones, right? They had their people and they of course they had their families, but they had their people too. And so I am so happy that now we can talk about it and now I can make it a priority and I could say, I have to go to my book club. I have to see my friends because, and even if we're Zooming it now, my college roommates it's part of aging well and it's part of my healing program. So I love that. Where it gets a little tricky is when people don't have the connection. And then that loneliness, we know that when people are living alone or they're feeling lonely, they don't even have to live alone. You could be in a bad relationship, right? But if you feel lonely, that is causing a release of negative hormones, negative nerves firing, and that is actually going to increase risk of chronic illness. We know that people have heart attacks. I'm sure you know this data better than I do, but when they went home, if they were lonely, it was like 2 years less mortality on how people aged after heart disease because they were of loneliness, and people who had dogs did better, simple things like that. And so it's really important. So I work hard. I have a lot of older patients, and so I work really hard to help them find ways to connect in their communities. And now we can't go out in our community. So this has been hard. This has been hard for me. It's really hard for a lot of my patients. So we're trying to be creative. What can we do? We can connect with each other. We can connect online. We can wave to neighbors, right? We can write letters. We can use our phones. We can visit people from 6 feet away as much as we can. And I just moved, so I'm establishing a new neighborhood, and it's so important to me that I know my neighbors, and I'm trying to make friends from a distance. And so yeah, it's really, really important. And I'm glad you asked about that.
No, I think relationship is, in my opinion, probably one of the most important pillar, because when you have a supportive relationship, not only you will thrive in terms of being a successful person, but in your health also. Like I said, loneliness is as bad as smoking when it comes down to longevity. So I think at the same time, I think with the COVID-19 and with the way technology rapidly advancing, I realized that seeing in person in one room probably is the best way to do it, but many times that's not possible. And that's why, like you explained, I think just as simple as waving a hand to a neighbor, or sending a text message and receiving a text message back, or getting on a Zoom phone call with a friend or with a group of friends, any kind of communication where there are two people involved. At the same time, any kind of communication, even when it's involved with a pet, even having a living plant in your house. So any kind of relation, not just with other humans, but relation with the pets, relation with the living, growing plants, relationship even with a fish in your fish tank. I mean, all those things will be the one which will actually make you healthier, make you happier, and will have a purpose that you are living for someone else. I think there's enough data that whenever a person has made a commitment for somebody else's life, they always have done better than commitment to themselves. I think we as human, we are always much more giving. And I think when we give to other people's needs and other people's cause, we actually ourselves doing better than when we try to do it for ourselves. So I think relationship is very important. That brings a next important kind of a burning question for everyone, particularly many of the women followers, women viewers, and that's about practical tips to lose weight. Obviously, a person starts smoking can start losing weight. Person becomes anorexic can lose weight. A person who goes on a keto diet can lose weight. But in my opinion, those are not a healthy way to lose weight. And like Dr. Michael Greger says, the goal is not to fit into a smaller cascade. Goal is to be healthier. So weight loss should be a kind of a side product of getting healthier, not the main goal. So what are your tips? What things you recommend to your patients, to your clients, when somebody wants to lose weight in a healthy way?
Great question. And I actually work a lot with my patients about this, because I see a lot of women who are going through menopause or postmenopausal, and things change, right? They were able to eat it and now they can't. Or, gentlemen that as they get stressed and older and more sedentary, they're not able to lose the weight anymore. And so my tips are, in general, adding in more fiber, so a whole food plant-based diet, and keeping it a real whole food. So that is so key. So just being plant-based is not enough. I don't want you eating crackers that are, plant-based or processed plant-based foods, but real whole foods with the fiber. So not even like rice flour, but have the rice, not oat flour baked into something, but actual oatmeal, right? So a real whole food diet is very helpful. So that's one tip that I work on people. And then I work on having meals and trying not to snack. We don't need to snack. We're not going to waste away if we don't eat for 4 or 5 hours, right? Or 6 hours. So if you need a snack, have a piece of fruit or something that you need, right? But to try to have your eating periods, and when we get on a little bit more of a schedule, it gets easier. And even for me in my busy life, and I still work different hours, but I still try to have a little bit of a schedule, which has helped me. And another thing that I work on with my patients is intermittent fasting. And so, or I should call it time restricted eating is what I work on with them. So by stopping eating earlier in the day, it gives your body time to digest. And every time we eat, we're spiking our blood glucose. Even if we're eating all this fiber food, we're still getting little spikes, and we're getting spikes of insulin, and insulin stores fat. So I teach my patients, we want to have periods where we're not eating. And so that's what the night is good for. And so if we can finish dinner by 6, maybe 7, you know what, everyone does the best they can. If it's later, it's later, but you do the best you can, and you finish your dinner. If you can finish a little earlier, and then you don't need anything but water overnight, and then you're no longer getting glucose or insulin spikes, and instead you're getting glucagon kicking in, which actually helps you break down, start to metabolize fat. And it's been very effective, and there's a lot of good data on time restricted eating for weight loss. So I use those tricks. And then the last one that I have to mention, and you've already touched on this, is calorie density. So if we're eating whole food plant-based, but we're eating nuts and we're eating whole grains the whole time, you know, we may be, or in dried fruit, that was the other one I was thinking of, we may be getting in too many calories still. And so going more to the vegetables as the base of the diet. When I try to build a really healthy whole food plant-based diet, the vegetables are sort of the base, with a little bit of fresh fruit. And then, you know, definitely our legumes and a little bit of whole grains and a little bit of nuts and seeds, but the basis really is our vegetables with some fresh fruit. And when we shift it more to that type of a diet plan, it seems a little more effortless for people, but it can be hard. I know that people are different with how they metabolize and lose weight. And so sometimes we have to work on some of these tricks.
Yeah, those are excellent tips, and I agree with you. I think if we make the raw vegetables and cooked vegetables, you know, without oil, our base, and then have, you know, small servings of fruits, very small nuts, you know, very small intact grains. And I think, like you said in the beginning of our life, that you had followed Dr. Furman, and I highly recommend everybody to get this book, It to Live. And that book actually has, this page is my most favorite page of my life. I'm 58 years old, and that page is page 216 from It to Live. And that page has a 6-week plan of how to lose 2 to 3 pounds per week, sometimes even more. And that page clearly shows what you just explained to us, that make your base is a whole vegetables, raw and cooked, 1 pound every day of each. 1 pound of raw vegetables, 1 pound of cooked vegetables without oil every day. And then add other whole food plant-based in a small amount. So I agree with you completely. Vegetables, if you want to lose weight. Let's talk about your work now. I saw you on Facebook. I've seen your YouTube videos, and you are very busy with your telehealth program. As I understand, you've been licensed into multiple states, I think 20 or more states now, and you have this very successful telehealth program now. So please tell us the name of the telehealth program, how people can sign up, how people can look you up to see what you offer, and how many states your program is licensed into, and what is the typical cost involved?
Excellent. Thank you so much for asking me. So I am now working with plantbasedtelehealth.com. So you can go to that website, plantbasedtelehealth.com, and you sign up for a portal. And then if you're interested in working with me, you can get an appointment. And it costs $150 for a 30-minute visit. And we send out a whole bunch of paperwork. As soon as you make the appointment, you get a whole bunch of paperwork. So you'll fill out a health history form, what medications you're on, what past medical history, what supplements. And I want to know everything about you. So you're going to fill out what you eat, what you do for work, how much time you have, how much you sleep, what you do for stress management, how much stress you have, who you live with, what you do for work, or I said that already, how much time you have to actually cook your food. And so I'm going to ask all of these questions in addition to your medical background. And so then when we have our visit, that we can jump right into it. And afterwards, I send handouts out, and we can communicate through the portal. I can order labs wherever people are, and I can order prescription medications wherever people are. And I'm currently licensed in 20 states. And I have 3 more that I'm working on that I hope I'll have very soon. So I'm excited about that. And it has been a pure joy to be able to work with people in these different states. And because one of the things we noticed was people would say, well, where can I work with a doctor that can help me with this? I'm reversing my diabetes, or I want to get off these blood pressure meds and nobody really can help me. Or, I look at a holistic approach to people. So I'm trying to put everything together, their inflammation of their gut function, with their asthma, with their, their allergies, with whatever's going on with them. And they weren't able to find a doctor. So now I can be there for them, and we're right in each other's homes. You get to see my little office here and I get to see your home, and it feels like we're forming real relationships. I don't know if you get to do telemedicine now, but I was a little nervous because I love my patients and I love getting to talk to them, getting to know them. And I wasn't sure if I'd be able to set up that relationship and feel so intimate with them, but I do. And I feel like we're getting really close, and I'm really getting to know these people, and it's been pure joy. So yeah, thank you.
That is just impressive. I'm very excited. I was telling Anthony that your company, actually, in my opinion, is what Amazon was in '95, and I think see where Jeff Bezos is. I think your company is a new concept. A lot more people are signing up. One day, your company will have more than 50, 100 physicians employed, and they will be contributing so much to the people's well-being. So I'm very, very thankful, very proud. I also personally like to say that when you offered that 30 minutes, $150, matter of fact, for each 30 minutes of face-to-face time involves another hour of preparation, reading the records, sending out to the records, making plans, and other things. So no, don't think that you got 30 minutes for $150. That means $300 per hour. Many people would think that's very expensive, but let me tell you, when you see a physician in the office for whatever 5 or 6 minutes, and that physician charges $60, there's not much more work. Here, there's a lot of legwork from Dr. Miller about what your life history is, about making a plan, working on your prescriptions, working on your labs, looking at the labs later on. So there is a lot of legwork which goes without even the person knowing about it. So I think, to me, it's extremely cost-effective program. And to be honest with you, if a person reverses diabetes, that's a savings of thousands of dollars, saving of a lot of suffering, living longer to see a grandkids graduation. So again, cost is a relative thing. I think to be honest with you, the way I saw you Zoom live today, you actually fit the perfect profile of a telehealth physician, because you're very animated, you are very smiling, you show your hands continuously, and you know your stuff, obviously, as a physician, but you actually come out as a very caring, very motivating, very coach type person. And that's what is required in telehealth, because when we are in person in the room, sometimes there is a benefit of just being in the same room. And on telehealth, you have to have personality to be a telehealth physician. And to be honest with you, you have that. So I'm very, very, very thankful that you take up this cause instead of just practicing lifestyle medicine for 1,000 or 2,000 patients in your town. You are available to the whole country now. So that's a great, great feeling. So please tell us, our viewers, our listeners want to hear, because I always feel like a story always goes beyond than just telling who you are. So please tell us one of the patient success story, obviously without giving any names or any identification, where you felt like this was the best thing I did for this one patient.
Yeah, that's a great question. Oh gosh, I have so many that I would love to share, but I just saw someone earlier this week, actually, who had been having gut issues. So he was having gas and bloating and severe diarrhea, and he had gone all over the country for this. And then he started to get joint pains, and he started getting pains when he was breathing, so inflammatory pains like pleurisy, I think he was diagnosed with, where his lungs were inflamed, so that was hurting him, and he was put on more and more medications, and then he had asthma, and then his blood pressure was high, and his cholesterol was high, and he was scared, and he was really, really scared, and he was seeing all these different doctors, and he had gone to Mayo Clinic. He lived in California, and so he had seen his doctors there. He'd gone to Boston and seen doctors there, and nobody was able to help him. He'd had multiple colonoscopies and scans, and he had made some dietary changes on his own. And people told him, take out gluten, or, maybe don't drink the dairy. And so he had made some changes, but he was not getting better. And so he came to see me, and he was really scared. He was a middle-aged gentleman, and he was a lawyer. He was very important in this world. And the first thing I felt in talking to him is his stress level. He was so, just so wired, so tightly, and he was so anxious about this, but he had a lot on his plate, and he was a high-end lawyer, and so we just kind of tackled it. I worked right away on the mind, right? Like I talked about, I jumped right into that because his stress level, I'm 100% sure that was contributing to all of that and why he wasn't getting any better. And so we worked on that, and we worked on sleep, and right away we started making dietary changes. We started adding the nutrients, especially the raw ones, and we worked on his gut. And so, if his gut didn't tolerate the raw, we did him a little bit cooked, and we adjusted as we needed for him, took out the inflammatory foods and the food triggers. And I had to make it a little easy for him because he travels and he works a lot. So he wasn't able to just be home all the time cooking his own food. So we made adaptations, and I wasn't sure how it was going to go. And he was kind of a little leery when I was telling him to take these deep breaths. That wasn't his style, but he did. And his gut completely resolved. He has no more gas and bloating. He has normal 2 bowel movements every day, which we are celebrating. I was so happy to see that and hear that. And his joint pains are gone. His blood pressure is down. His doctor's taken him off his blood pressure medicine already. And we're going to be checking his cholesterol soon. He lost about 18 pounds already in just like 2 months. Oh my gosh, I'm still like celebrating him right now. I'm so proud of him. And he did the work. He thanks me, but I say, I didn't do anything. You ate the food, you worked on your stress. And he's just one of my favorites. But I have a lot of patients like that are making these amazing transformations that I can't even believe it.
No, I think this is a great story and great example. And I think the thing I like about your approach is that you address every aspect, every pillar of staying healthy. And like you said, stress management was much of a larger issue. And unfortunately, many physicians are not equipped to handle that part. I mean, many physicians would just say that your blood pressure is high, here's the pill, your cholesterol is high, here's the pill. But they are not looking at the root cause. They're not looking at all 6 pillars. And you right from the beginning realize that stress probably is playing as important a role compared to some of the other unhealthy behavior. And you address every one of them. So I think the results for him is because of your analysis of what is important in his life instead of just pushing the pills and procedures. So, this is a great live we had. I'm very, very thankful for you to come on our live. I think this will be on YouTube in a few hours. So be available to all the viewers. It'll be available to you. And we'll be bringing you every 6 months probably to make sure that we know where you are going, how many more states you are licensed into. Maybe you will be licensed into India too, so some of our followers from India can talk to you too. So that would be a great feeling. So
I would love to. Oh my gosh, that would be such an honor. Thank you so much for having me today. This has been fun.